Hi there, my name is Miranda Under and I'll be demonstrating how to reconstitute a IV medication and administer it through the CIVA pump. So I'm going to start here with just a little hand hygiene and then my first med check. So I have penicillin here. The order is penicillin G, sodium 3 million units, IV, Q4 hours in the CIVA pump. So I'm just making sure that I have the right patient. So this is for Emma Wrightson. And then that I have the right drug, penicillin G, for injection, so IV, 3 million units. There's 5 million units in here, so that's good. And for right now. Alright, so at this time I'm also going to look at my drug monograph because it has to be reconstituted. It's going to tell me that for the 5 million unit vial, I'm going to add 3.1 milliliters for a final volume of 5 milliliters and a final concentration of 1 million units per ml. While I'm looking at my monograph, I'm also going to note that the classification is antibiotics, that it can be administered by a student nurse, and that the dose is within the usual dose, so it's 1 to 4 million units, so it is appropriate. And for the CIVA, I'm going to look at the CIVA pump infuser administration record. And for 3 million units, I'm going to be putting 30 mLs in a 30 milliliter syringe on the normal rate. And it's going to be infused over 35 minutes. All right. So, perform hand hygiene. Open my vial caps. I'm going to perform just using a alcohol swab, cleaning the top of the vials. I would clean it for 30 seconds and let it dry for 15, but for the sake of time for the video, I'm not going to be doing for the full minutes. Alright, so according to my drug monograph, again, it's 3.1 mLs of sterile water that I will be diluting the concentration with. So I'm just going to wing the package so that I maintain sterility. And just fill my syringe with the air that I need to use to displace the pressure. So 3.1. So because it is the dilutant, I am just making my best estimate to go between the 3 milliliters and 3.1 milliliters. If this were a medication, that would not be an option just because it needs to be more exact, but for the dilutant it is appropriate. So I'm just drawing up the 3.1. I'm just going to make sure that I don't have any bubbles in there.
So according to the monograph, the dose is penicillin, is an antibiotic, given by a student nurse. The maximum single dose is 2 grams. And I'm giving 1 gram, so it's within the safe range.
So I would do this over a sink. But if you can see, 3.1 between the 3 and the 0.2. And then going to inject it into my penicillin vial. I'm sure that the sterility of the top was maintained, but just in case, if you were worried, you could re-clean the top. And I'm just going to displace the air, the 3.1 milliliters of air for the water that we entered. Recap my syringe to maintain sterility, and then just rotate the vial slowly, and this mixing it this way ensures that we don't create additional bubbles into the vial that we don't want when we're pulling it up. And I'm just making sure that everything is diluted. It is. All right. So now I'm going to be drawing up my dose. So my dose is 3 million units, and I calculated that equals 3 mLs. So I'll be drawing up 3 mLs of the dose, the penicillin here. So I have the air displaced. Make sure it's up to 3.
And I'll mix the medication vial. So the final concentration
Actually,
is 50 milligrams per ml, and I need 1,000 grams. I need 1,000 milligrams. So I calculated it, and I will need to draw up 4 mils. So I'll take 4 mils of air, and then 4 mils of the drug.
I'm just drawing up the 3 mLs.
I do that before. Well, you have this picture, right? So now I'll do my second check. I'm going to be demonstrating
Tapping.
right drug is.
Sure, there's no bubbles in there.
Compared my mark, drug is and the right dose is 1 gram, root is IV, and frequency is every 6 millimeters, which is now.
So our patient is Emma Wrightson.
Okay.
She is allergic to morphine.
Again, I would be doing this over the sink, okay?
Now I'm
And
going
And so
to check the monograph, and it says that I have to dilute the
I have the 3 mLs.
250 mils of saline, and it's compatible with the IV.
All right. Now I will be drawing up 27 milliliters of normal saline out of a mini bag in order to dilute the
I want to make sure that no
every 8 hours, and infusions according to my chart is
medication appropriately.
So I'm just going to check my monograph. So Cephalzon is an antibiotic, and according to my patient's physician's orders,
The needle was just placed upside down, so
by a nurse or student nurse.
maintaining sterility.
5 minutes and 1 gram every 8 hours, and my dose is 250 mg.
Displace the air.
Category, so 6 to give. My maximum single dose is 2 grams.
I can attach my tube,
And then I'm going to clean the mini
And
bag
maximum
port.
daily dose is 12 grams, and again, 650 mg every 8 hours is safe. 12 grams is safe as well. So to begin with, I'm going to reconstitute this medication. So according to my monograph,
So for 30 seconds again, and then let dry for 15. I'm letting the IV bag hang off the edge there, so I know that it maintains the sterility.
the integrity isn't compromised at all either. So I'm removing the tabs,
so now I'm going to enter the patient's
Inserting it.
moving the top,
I'll do my
Using the
safety
air.
check.
swabbing for 30 seconds.
Side rails are
Dry
up.
up 27.
And I'm going to do my hand hygiene first, and then the IV infusion is running. Patient isn't in any distress.
Taking up, so I need 10 ml of sterile water to reconstitute this
Hi, my name is Denise.
syringe here.
Are we giving
Loading my blood needle.
today? I'm your student nurse.
Bringing back my package to your wrist.
Getting rid of any bubbles in there.
Phone number 534-678-9.
Maintaining the sterility of the tip.
So birthday and your allergic shock. Your IV site
As well. So I need
is
10 ml.
good. There's no redness or
Draw
swelling.
10 ml of air into
27
my
And
syringe.
today the drug I'm
milliliters.
giving you is cloxicillin. It's an antibiotic.
Now I'll be doing my second med check.
Stomach pain and you might get diarrhea. So just let me know if that happens. I'll do my third check.
So
So the right
I have
patient
my
is on the right side. Sterility of VIN number is 123.
vial here, penicillin G, so right drug for Emma, right patient, right dose 300 milliliters, or sorry, 3 million units, which equals 3 milliliters, which is what I have here in my syringe. for IV, and the time is right now. Now I will place the remaining syringe into here, removing the cap, maintaining sterility. And this would just be recapped and placed in the sharps. Place my blue cap on. Make sure there's no bubbles, and ensure that it is a volume of 30 mLs. So I just lost my blue cap. In this instance, I would use the call bell to have a nurse grab me another one. And in the meantime, I'll just place my label. So I just had a nurse pass me a new blue cap, and in the meantime I put my label on my medication. And just look at my label. Okay, and then I'll be moving to the bedside. As I'm entering the room, I'm doing hand hygiene, introducing myself. Hello, my name is Miranda. I'm your student nurse today. I'll be administering your penicillin. Do a little patient education. This is for your meningitis. You may experience nausea, vomiting, any signs of allergic reaction, so rash. I'm just going to ask the patient if she can repeat her name for me and her birth date, 2 identifiers, and I'm just going to identify also that the allergies on the MAR match her wristband. And can you just confirm your allergies for me? Okay, yes, thank you. I'm also doing a safety check as I enter, assessing whether or not there's any issues in the room, and if the IV running is already running at the right rate, and that the penicillin, the IV is patent, and there's no signs of phlebitis or infiltration or infection. Now I will attach my line. Attach my line. So these 2 ends are sterile, so I'll just maintain sterility as I'm doing this.
My second med check before I re-dilute it. So right patient, right sim, right medication, cephalexin, and I have my right medication here, cephalexin.
And then I'll be priming.
Dose is 600 mgs. I know from my calculations I have.
Remove the cap.
Can get it from this 1 gram of bottle after reconstitution, which equals 6.8 milliliters. Right throat is IV. Right throat is IV. And
Slowly until I see a bleb. All right. Place the cap and place the syringe in the CIVA pump so that the
100 ml. I've chosen to give it 100 ml of I've chosen 100 ml.
phalange is in the notch and facing forward, and then bring this down. In the documentation, it said to start normal, so I'll eventually start normal.
So I'm taking sterility of my syringe.
I'm attaching it to the second port here in case the patient is receiving any IV push medications. And I'm just making sure that the IV is again running at the right rate. So 30 seconds again there, and 15 seconds to dry. Attaching this here and pressing start. Seeing the green the green light flashing ensures that it's running, and then at the end I will, after it's finished infusing, I will come back. So after the 35 minutes, and I will flush the line with 3 mLs of the syringe, 3 ml syringe of normal saline at the same rate, just to clear the line to ensure no medication is missed. And then at the end, I will just document that I gave the medication.